WBZ's Dr. Mallika Marshall joins me now to answer some of your coronavirus questions. Doctor, great to have you with us. We're going to get to the first question now, which comes to us from Sylvia, who writes, I'm concerned about the heart side effects young kids are having with the COVID vaccine. I have a 12-year-old son, not sure what to do at this time.
Yeah, I mean, I understand why parents might be concerned. So as many people know, there have been these reports of rare heart inflammation after vaccination with one of the mRNA vaccines. So we're talking about Pfizer or Moderna, mostly in males 16 and older. And the condition tends to respond very well to treatment. And given how rare this potential side effect is and the greater risk of complications from COVID-19, even in young people, the CDC is still recommending that all people ages 12 and up get vaccinated. I had my 12 and 13 and 16-year-old vaccinated without really any reservations, and they did just fine.
Okay, that's reassuring.
Yes.
Donna writes on Facebook, I have autoimmune hepatitis and am on Imuran. I had the J&J vaccine. How protected am I?
So for those people who don't really know what Imuran is, it's a drug that is used to suppress the immune system in conditions like rheumatoid arthritis or after organ transplant, and obviously in your case with autoimmune hepatitis. Now, it's still unclear how well people who are on Imuran and other immunosuppressants actually are responding to the COVID vaccines. It may be advised at some point that people like you get a booster shot for added protection, but don't go out and do that yet. Before you do that, talk to your personal physician. But I would also advise patients like this to remain vigilant when they're out in public and around others. Wear masks, and especially when you're around people who are not vaccinated, because they could obviously pass the virus on to you.
Right, critically important to protect yourself in that way.
Right.
Linda writes, I had kidney and bone cancer and take a chemo pill every day. I had the Pfizer shot and am wondering if I'm protected.
You know, there was actually a recent study that just came out a few days ago suggesting that about 94% of patients with cancer actually develop good response to the mRNA vaccines. We're talking about the Pfizer and the Moderna vaccine specifically, usually 3 to 4 weeks after receiving their second dose. And interestingly, people with blood-related cancers like multiple myeloma or leukemia were less likely to produce antibodies than people with solid organ tumors. So we have a little bit more data than we had before. Obviously, check with your personal physician.
All right, and this question comes from Sally, who wrote into us on Facebook. She writes, my friend and her husband are not getting the vaccine. All right, doctor, try to answer this one. Why are people still refusing to get it?
The age-old question.
Yes.
I think it's a number of reasons, and individuals have their own reason. First of all, there's still a lot of misinformation out there being spread, which of course is scaring people unnecessarily. For example, there's this rumor that you may have heard of that the vaccines can cause fertility problems in women, which is absolutely not true. Some people are still believing that. Some people are worried about the side effects, even though they're usually mild and usually go away within a couple of days. Some people are just simply too young to get vaccinated, so people under the age of 12. Some aren't getting the shot because they say, hey, everybody around me is getting the shot, so why do I need to? I'm being protected by them. But of course, with this highly contagious Delta variant and other variants that might be around the corner, people who are not vaccinated really are at risk of getting seriously ill from COVID-19. So please get vaccinated.
Okay, this is the flip side of that last question. Pablo writes on Facebook, what will happen if you take 4 shots of the COVID vaccine within a month?
Okay, Pablo, I don't know why you're asking this question, but let me just make it clear. It is not necessary right now to get more than 1 dose of the J&J vaccine or 2 doses of either the Moderna or Pfizer vaccines. Now, some people have accidentally been given extra doses than recommended, and while they might develop more side effects, they do generally tend to do just fine. But please, right now, don't go out and get any more shots than are recommended. We will let you know when that time comes.
No need to be an overachiever in that department right now. Dr. Mallika Marshall, thank you.
You're welcome.
Dr. Mallika offers her best advice, but as always, consult your personal doctor before you make any decisions about your health. If you have a question for Dr. Mallika, there are 3 ways you can reach her. Email drmallika@cbs.com, on Twitter @Mallika Marshall, or you can Facebook message her, Dr. Mallika Marshall. Anna Rittis?
All right.